Welcome, everyone. Thank you, Katya. Okay, now we'll get started. So I'd like to welcome everyone to our third from the last ENHS-GSO GSO seminar series. And as we mentioned last week, our last four presenters of this semester are all students of ours who are getting closer and closer to being able to perambulate across the stage at graduation. And so today we have Zac Hart, who's going to be presenting at least preliminary, if not close to final, results of the dissertation research that he's been working on so diligently for, I've lost track of time, some period of time now. And Zac is part of our OHHC2I community engagement core, as well as he has been supported in part by our Southeast Coastal Ocean Observing Regional Association. So Deborah and Abby, I got it right this time. And we have Abby Wakely and Deborah Hernandez from Socorro who have joined us. And we also have Lindsay from DHEC, who coordinates, heads up, directs our beach monitoring program for our Tier 1, Tier 2 beaches in South Carolina. Dr. Scott, before I turn it over to Zac so that he can further introduce himself, do you have any words of wisdom to pass along?
Just really looking forward to Zac has had quite a journey, challenges of COVID as he started his research, but he didn't let that stand in his way. And so, Zac, we're really looking forward to seeing the outcome of a lot of hard work. So looking forward to it.
Thank you, sir. Can I go ahead and share my screen?
One of the quick introduction, I just saw that Aspen Cook from Moat Marine Lab, who's also one of our partners in our new Socorro funded initiative, has joined us. So no pressure, Zac, but a whole lot of our colleagues both within and beyond the department are here. So yes, the floor is yours, sir.
Sounds good. Thanks everybody for joining. I'm flattered to have so many people from outside the UofSC family. And I'll go ahead and get the presentation up here. Is everybody seeing it okay?
Yes, sir.
That's great.
Great. So happy to be presenting some close to final results of my dissertation work entitled Assessing Stakeholder Needs and Preferences for Coastal Swimming Advisories in Charleston, South Carolina, which of course is where I live and I'm sitting right now. So I'll start off with some very important context. And that context is the Beach Act, which if you ask me is probably the best acronym that the federal government has ever come up with, because not only is beach actually a word and an acronym at the same time, but it's also relevant to what the Beach Act does. So they really had to hit a home run with this one. Beach Act stands for the Beaches Environmental Assessment and Coastal Health Act, which was a year 2000 amendment to the Clean Water Act. So this is federal law that's here to stay. And it was basically a response to the recognition of growing public health risk to people engaged in recreation in beach waters. So the recognition early on was that this risk stems from viruses, bacteria, and protozoa in ocean waters, with the most commonly documented illnesses being acute gastrointestinal illness, or AGI, which we probably all experience from a day at the beach at some point in our lives, along with respiratory illness, skin rashes, and eye, ear, and wound infections. And all of these symptoms or potential illnesses are, of course, exaggerated among the young, the elderly, and those with compromised immune systems. So the Beach Act did several very important things. First of all, it called for a revision to the recreational water quality criteria that EPA first published in 1986. So these were quite outdated standards. And when the act took effect in 2000, that also triggered a series of pretty large-scale research projects that occurred, I would say, throughout 2002 to 2010, trying to get a better grip on the prevalence and the illness and the causes of illness among those doing coastal recreation. So that series of epidemiological studies during that time did indeed lead to a revision of the criteria in 2012. And the Beach Act also clarified or required that these recreational water quality criteria be revisited every 5 years to make sure that they're keeping track with the science. So the latest revision, or sorry, the latest review of the criteria occurred in 2017, and it didn't result in any specific changes to the existing criteria, but a point that's probably of interest to many of you is that the 2017 review did suggest that states start to get a little concerned about a couple of the toxins produced by harmful algal blooms, specifically microcystin and cylindrous spermopsin, were suggested as items that states might want to start considering developing their own criteria for. So the Beach Act also, of course, required states to adopt their own state-level beach water quality criteria. And then I guess third, and probably most importantly, the Beach Act established a grants program to provide states with annual slugs of funding to do two main things. One, of course, is to conduct routine monitoring of beach water to, gauge health conditions and to see what things are looking like out there. And then, of course, to notify the public when safety thresholds were exceeded to make sure that public health was being protected in an appropriate way. So the Beach Act gave states quite a bit of flexibility and latitude in terms of how they implemented the notification piece of the program. They did include some kind of broad guidance and criteria suggesting how it should be done, but they really left it to the states to decide how they wanted to do it with their own populations. So over the 2 decades that followed implementation of the Beach Act, there were several methods that became pretty much commonplace across the board and are practiced today in almost every state. So the first of those is websites. Agency websites, they're kind of all over the spectrum. They range from really simple text-based web pages that list where advisories are active. On the other end of the spectrum, you can find really interactive GIS map-based websites that where a user can basically enter in an address or a point of interest and find out what advisories are active near that point of interest. So those range widely. Websites are used by pretty much every state. Signage at popular beach access points is another one that you see in every coastal state. Local media and press releases are really common too. The agencies in each state who implement the Beach Act, typically when an advisory is triggered, they'll get in touch with local media outlets who will then print it in the newspaper or more likely announce it on local news TV. And then there's a handful of states, or more than a handful of states, I think the last count was roughly 75% of them, use telephone hotlines with the idea that people who are headed out to the beach for a day might call this 1-800 number just to make sure that conditions are safe for them and their family. So 10 years into implementation of the Beach Act, the EPA decided to do a little introspection, and they sponsored an external evaluation of the notification component of the program. And the findings were pretty interesting. So this evaluation was conducted with just a subset of coastal states. I believe it was 8 states, 5 local governments, and a handful of tribal governments. And what they found in that evaluation is that most states were not designing the notifications based on the needs of their target audiences. Instead, states were basically doing what came naturally or was convenient or what had been done in other notification type programs within the state. They also found that there's no standard format for notifications across the country. So the actual language of the warning itself might be different from state to state, which could obviously create confusion among people. So we call them swimming advisories here in South Carolina. I learned just yesterday that in Los Angeles counties, they refer to them as ocean water quality rain advisories. So a bit of a mouthful there, but it essentially refers to the same situation. And the evaluation also found that research on beachgoer awareness and understanding of the advisories itself is very limited. So when you add all this up, again, it kind of suggests that confusion could very easily be created among people, especially those who are moving from beaches in different states. So to change the focus a little bit, I want to kind of zoom in a little bit and talk about how the Beach Act is implemented in South Carolina. So the South Carolina Department of Health and Environmental Control is the lead agency here. And thanks to those of you from DHEC who are on the line today. DHEC has the monumental task of monitoring approximately 120 beach sites up and down the South Carolina coast between the months, or during the busy recreational season of May 1 through October 1. And they're fortunate to have 3 coastal locations in Myrtle Beach, Charleston, and Beaufort, where they can actually process the samples themselves in-house. So that cuts down on some of the lag time between taking the water samples and getting results. So in general, swimming advisories are triggered when enterococcus levels exceed 104 colony forming units per 100 milliliters. And then long-term advisories are issued at sites with more than 10% exceedance over the last 5 years. So these places with long-term, or this list of long-term advisories, is actually revisited at the end of every recreation season, and it's typically updated a little bit. I think at this point there's somewhere between 10 and 15 sites with the long-term advisories in effect, and in reality, these are all concentrated up in the Grand Strand region of South Carolina, so in the North Myrtle Beach, and surrounding towns. With the main reason being that development up there historically has permitted stormwater outfalls directly onto the beach. So this creates some issues in a very heavily developed area like that. So in terms of notification and how that's done in South Carolina, DHEC uses many of the most common practices that are used in other states across the US. Permanent signage is used in those spots with long-term advisories. You've probably noticed these if you've been to the Myrtle Beach area yourself. DHEC also uses a couple of different agency webpage resources. So there's one site that is just commonly referred to as the Beach Monitoring page, and it's got some basic educational information, and it now has a list of active advisories in the state. They also have the South Carolina Beach Guide, which you see a screen grab of on the page here. And this is a really cool interactive GIS-based site where you can, again, enter your address, or you can select from a drop-down list of beaches in whatever area you might be interested in. And along with beach water quality conditions, this also has some other helpful information, especially for tourists, things like beach access points and other amenities. And then, of course, press releases are also used here in South Carolina. They're getting away from that in certain areas. They're piloting a new method, I'll call it, in Myrtle Beach, and I'll talk about that a little bit later. But for the rest of the state outside the Grand Strand, press releases are still used when necessary. So let me zoom in a little bit more here in South Carolina, specifically into Charleston, where I live. So the situation in Charleston is interesting in that our beaches are generally in very good shape, but we do have a lot of tidally influenced rivers, creeks, and even Charleston Harbor that occasionally serve as pathogen hotspots. Now, these places are incredibly popular for water-based recreation. Scenes like what you see in this photograph are really common on the weekend. People love to do kayaking and stand-up paddleboarding, fishing, swimming, you name it. The waterways here can get quite congested over the weekends. And the challenge is that these particular waterways are not under the purview of the Beach Act because they aren't beaches, technically speaking, even though they're, directly connected to the beaches in many cases. So they aren't under the purview of the Beach Act. Now, some of these waterways are monitored under other surface water quality monitoring programs, but not in the same comprehensive routine kind of way that a lot of these beaches are. So that creates a little bit of a risk communication void and creates some risk for these people who are getting out there every weekend. So this issue is a pretty high profile one here in Charleston. This is a fairly recent newspaper headline that refers to Shem Creek. Shem Creek unfortunately has the affectionate nickname of Shit Creek among locals here because it's wildly popular, but it's very routinely, wildly exceeds water quality safety thresholds. Ironically, it's lined with restaurants on either side of the creek. So there's always people, doing waterfront dining. And it's also home to, I would say, probably a half dozen water-based recreation businesses where people come, sign up, and then they get out in kayaks or paddle boards, just like what you see in this photograph, and they take off from there. And so, again, a pretty high profile issue here in Charleston, but not a terribly recent issue. This is something that's been going on for years now. Just to give you a snapshot of the newspaper coverage, I mean, I feel like I see these headlines almost monthly about water quality, but this is just a selection to show you that, we have it as recently as 2021, going back to 2016. So this has been covered in the news for at least the last 5 or 6 years, and there's probably many more articles preceding these. So it's such a high profile issue that in 2009, a nonprofit organization called the Charleston Waterkeeper was founded with the mission of basically keeping an eye on these slightly inland waterways, serving as a watchdog to make sure that these waterways remain swimmable and fishable, which is ultimately the goal of the Clean Water Act. So their sampling routine is pretty similar to DHEC's. They conduct weekly water sampling during the busy season through October 31. So they go a little bit longer than DHEC, but they take their measurements at about 20 different popular sites in Charleston that are popular for recreation. And these are all sites that are not on the beach, but slightly, you could say, in some of the tidal rivers and creeks. So they take their samples generally in the middle of the week. Charleston, and then they get their results in a day or two, and they typically announce that new results are available via social media. And then for those people who have actually subscribed to their weekly email updates, they send out on Friday a weekly water quality update via email that is, designed to be just in time for the weekend when a lot of people have the time to get out on the water. The Waterkeeper also has a fantastic website. And what you'll see here is that really cool feature of the website is that the map piece of it actually integrates the data from DHEC monitoring. So you're getting more bang for the buck with this map because it includes the results of both agencies, of both organizations. This screen grab I took just last week, and so I should call attention to the fact that all the beach locations, I mentioned earlier that the beaches in Charleston are generally in great shape. And that is absolutely the truth. Under normal circumstances, all these beach dots would be green. But because we are after October 1, in other words, we're outside of the DHEC monitoring season, we see yellow for all the beaches, which basically means that we don't have any data on these sites right now. But the Waterkeeper is still actively sampling and testing. So in their 20 or so sites that are a little bit upstream, we see kind of a mixed bag here. We see 1, 2, 3, 4, 5 hot spots, which honestly, from my experience, is a pretty good week. I've seen situations where more spots were red than were green. So that's typically after heavy rainfall when there's all kinds of stuff in the water. But so this is kind of a typical weekly update that you would get from the Waterkeeper, showing the results of both monitoring groups. So to kick off the project design, my committee and I decided that we wanted to sort of loosely follow the tenets of community-based participatory research to help inform and design the project, which is a really common approach in public health. So with that in mind, I kicked things off by doing informal consultations with 6 different local subject matter experts representing 4 different organizations. And the goal of these consultations was really just to get an understanding of the lay of the land and to be able to articulate the context that I just talked about for the last 10 or 15 minutes. So these were informal phone conversations, and I basically just posed 5 basic questions to each of these experts, focusing on current water quality situation, what they see as the roots of the problem, what they see as people's willingness or interest or use of water quality data. And then most importantly, I asked them, or I gave them kind of an opportunity to help shaped the project itself. And I asked them, what data do you believe I should collect from stakeholders? And I'm glad that I did ask this question because it shaped the project in a pretty substantive way. So these consultations led me and the committee to develop 4 specific research questions. The first being, to what extent are stakeholders aware of water quality problems? Secondly, to what extent do stakeholders want to be made aware of potentially dangerous conditions in the water? This was an especially interesting one to me because I thought there was a risk of there being this mentality of, people not wanting to know, head in the sand, just wanting to go out onto the beach and have a good day and not really think about what might potentially be in the water. Third research question was, what entities would stakeholders consider credible sources of water quality messages? This is a really important one because over the years, environmental issues have been heavily politicized. And of course, these days, public health issues are heavily politicized. So the person delivering message related to environmental or public health can really have a major impact on people's reaction to it. And a fourth research question is, what characteristics of water quality messages would be the most likely to spur behavior change among stakeholders? So this research question really focused on both the content of the water quality message as well as the way that it's delivered. So kind of two streams with that question. So these questions led us to target 2 specific target audiences. And more broadly speaking, this was an exploratory project using mainly qualitative social science methods to collect data from these 2 target audiences. The first target audience was, of course, recreational users of beach and non-beach coastal waterways. I reached this target audience through an online survey. The second target audience was owners and managers of water-dependent businesses. And this was actually a suggestion from one of those subject matter experts that I talked to during the project design phase. This person suggested that the business owners, because they have a vested financial interest in the water, and because in an ideal world, they're kind of serving as safeguards of their clientele, the person thought that these business owners and managers might have a pretty unique take on the issue, which they did. So in terms of research methods, so first off with the survey, I should say that I did have grand visions of administering the survey in person as well. I wanted to get out there at recreation type festivals and also stand at some public beach access points and administer the survey with clipboards and iPads in person. But when I really kicked off the survey piece of it was last spring, early summer, and COVID basically brought the festival industry and the tourism industry to grinding halt. So there was not a lot of that happening here in Charleston. So I did have to limit the survey to an online survey, but fortunately I got a good response rate that I'm happy with. So I don't feel like it was terribly damaging to the project. So the survey was designed with Qualtrics, and it was accessible via computer or mobile device. It was distributed mainly through informal social networks and email groups and listservs, Facebook groups focused on coastal recreation, that type of thing. And it included 25 different questions. So it was a longer survey. Rest assured that Qualtrics kept giving me warnings saying, okay, you're risking losing people's interest here. You're getting a little bit long. But I just felt that having a fair number of research questions or survey questions in each of the 4 research question categories was really going to be essential. And I incentivized participation by offering 3 $100 gift cards to a local outdoor store. Half Moon Outfitters, those of you who live in the area might, actually, I think they have stores in Charleston, Columbia as well. So probably everybody's heard of them. But the gift cards seemed to do their job because I had 163 unique survey participants, and surprisingly, 143 of them completed it. So that's in my book, that's a pretty solid survey completion rate. And in terms of the demographics of the people who responded, so 95% were full-time residents, 33% were active more than 3 times per week, and 39% were active 2 to 3 times per week. So in general, people who responded were incredibly active on the water and basically getting out there whenever free time permitted. I asked people what what types of recreation they were most involved with, and the most popular answers were swimming, surfing and bodyboarding, boating or sailing, kayaking, and paddleboarding. So looking specifically at awareness of water quality problems, 126 out of 146, or 86% of respondents reported at least slight awareness of the issue. This didn't come as a surprise to me because, again, this is a pretty high profile issue in the area. It's been covered extensively in local media, and it's hard to find anybody who lives here who, at least hasn't heard something about this. So most people were extremely or moderately aware, and then there was a handful that were just somewhat or slightly, but awareness of the issue itself was pretty widespread. By contrast, we had only 62% of respondents reported using available water quality info to make decisions about entering the water. So a little bit of a disparity there in terms of knowledge of the issue as compared to people seeking out information to make decisions. And I asked a probing question to those people who had never used info, and all the responses pretty much fell into one of two categories. Either they didn't know that water quality was an issue, or they simply didn't know how to access the information. So pretty sharp dichotomy there. In terms of desire to know about risky conditions, so I specifically asked the question, if I were planning activities that would cause contact with coastal waters, I would want to know if the water would make me could make me ill. Overwhelmingly, people did want to know if there was a risk being posed to them by getting in the water. 58% strongly agreed and 31% agreed. So this was kind of reassuring, and that people do not have that bury their heads in the sand mentality, and they actually did want to know when a day at the beach could potentially have some repercussions for them. With respect to the questions on trusted sources of information, so local nonprofit organizations were the most trusted source of information, and I think this stems largely from the presence of the Charleston Waterkeeper. Actually asked the Charleston Waterkeeper to distribute the survey to their membership, which they thankfully agreed to do. It didn't yield a ton of extra responses, so I don't feel like responses are skewed towards people who just, have a certain affection for nonprofit organizations for whatever reason. Sending it out through them, I think, garnered 12 or 15 responses. But importantly, nonprofits at the national level also earned high levels of trust. And unfortunately, government at pretty much all levels were ranked really highly as trusted as well. The only places where you see the significant dips is when it comes to the media. So people are a little more leery of hearing information from local and national media when it comes to this topic. So probably the most dense section of the survey was this section exploring people's preferences for learning about bacteria levels. Obviously with time constraints, there's no way that I can talk about results for each of the 25 questions. So I've just kind of plucked what I see as some of the most important ones. And in this section, it was really interesting to me that 77% prefer to be notified automatically rather than seek the information out myself. This didn't come as a surprise to me because the literature on behavior change clearly shows that even when people want to engage in a behavior, sometimes they just simply forget to do so. And so in this situation, it seems like a lot of people, want to know, but they simply forget to, or it's an obstacle to them to have to go to a website and try to get the information themselves. So more than 3/4 reported that they would love to just have it sent directly to them when circumstances dictate that they should get that warning. And then as sort of an add-on to that, respondents were asked to rate how likely they would be to enroll in automatic notifications about dangerous bacteria levels in waterways that you use. And 89% of all of them, 89% of the whole group chose one of the three likely responses. You see in the graph here that 70 chose extremely likely. So pretty clear consensus here that that would be a popular option for people to have, at least in the Charleston area. So in terms of preferences, again, continuing on this chain of preferences for learning about bacteria levels, I did ask people for their general reactions to the term swimming advisory, which is what's used here in South Carolina. And people were kind of lukewarm on the term. Most of them felt that it was slightly informative, but could be and should be much more specific. And so I asked people if they had suggestions on what other kind of details should be included in the advisory. And a lot of people had feedback on this, so some pretty specific feelings. So 123 individuals offered open-ended feedback to this question. And the most common ideas that they suggested were to include risk level, so an indication of how dangerous it actually was. They wanted to know the cause of the advisory, be it from bacteria or an oil spill or whatever the case may be. And they also wanted to know the illness or symptoms that they could expect if they ignored the advisory and went into the water. So to switch gears a little bit now and talk about the interviews with water-dependent business owners and managers. So I got 10 interviews altogether, and this was achieved through snowball sampling, which is basically a fancy term for asking interviewees to suggest additional people that meet the criteria for an interview. And then, of course, I would follow up with them. And this was really effective. Each person that I spoke with suggested probably 2 or 3 other names. It's a fairly small community. You know, there's only so many businesses that are in this line of work. I would say probably 20 to 30 in Charleston. So a lot of people were referring the same names, but I was able to get 10 individual interviews. These were semi-structured recorded interviews that were conducted over the telephone. I had 9 scripted interview questions that I piloted with a subset of the target audience, some of whom are on the line today. And then there was a handful of ad hoc probing questions that I posed to a few of the interviewees. Each one of the interviewees was sent a digital $5 Starbucks gift card just to thank them for their time. The interviews ranged from, I don't know, some people were really short and sweet and it only took 6 or 8 minutes, and then others were really eager to talk about this, and it took, I think 25 minutes was the longest interview. And interviews were professionally transcribed by a service called Rev, and then the transcriptions were analyzed using a content called content analysis. So if you don't have any background in the social sciences, content analysis is basically a way to systematically and methodically organize and analyze large sets of qualitative data. So you can use it for anything ranging from interview transcripts, obviously, to newspaper articles, to website pages. You can even apply content analysis to paintings if you wanted to convert the paintings into written descriptions. But basically, the gist of it is that it's a way to systematically identify recurrent themes or concepts or really important ideas that are present in your data. So in terms of results for the interviews, looking at that first research question on awareness of water quality problems, 9 out of 10 interviewees expressed concern about the health of Charleston's waterways. And 5 interviewees specifically felt that reports of poor water quality had negatively impacted their business. So there was a handful of them that said that newspaper headlines one day immediately resulted in people calling in, canceling their bookings, you know, even that afternoon or the next day. With respect to desire to know about risky conditions, 8 out of 10 interviewees regularly use available water quality data to inform their activities. And so the consensus here was that many of them check these resources, and if they see that conditions are bad in a certain spot, then they might just shift their activities over to another spot that seems to be in the clear. So all 8 of them reported using the Charleston Waterkeeper, and a handful of others were reported as well. In terms of trusted sources of information, 7 interviewees specifically mentioned the Waterkeeper as a trusted source, and also earning high levels of trust were NOAA, the Department of Natural Resources, and of course DHEC, and local media and news seemed a little bit more trusted among the business owner group than the general recreation folks. So in terms of preferences for learning about bacteria levels, 8 out of 10 interviewees unprompted indicated that they would prefer to receive a direct alert when conditions are risky at a site. And I say unprompted because the question here was basically what I said to them was, in an ideal world, what would be the perfect way for you to be notified or to get this information when maybe you shouldn't take your clientele to a certain spot one day? And so for 8 out of 10 to them to kind of come up with this idea on their own, it's pretty compelling to me. And I pulled just a single one out of several really good quotes that kind of summarize it. This interviewee said, so I would say perfect for me is an optional subscription to a text service that texts you either a daily water quality report or texts you if quality has decreased to a level that might be deemed unsafe. So a few discussion points. So clearly, the results from both the survey and the interviews point to the fact that stakeholders would be very enthusiastic about notifications or alerts that are pushed to them in real near time. I say real near time, excuse me, near real time. I say that because one of the survey questions also focused on when people would be most likely to seek out this information or to use it. And the most common answer was the day of. So people don't want to know 2 days before or 1 day before. They want to know that morning whether or not they should change their plans for the afternoon to get out on the water. So an important question that I think bubbles up from that is, could DHEC and or the waterkeeper explore an app or messaging system that would kind of fulfill this stakeholder want and need for, you know, that more direct notification? And in reality, this might just look like, you know, especially for the waterkeeper right now, they send out their Friday email blasts. In reality, this might just turn into a text message system, but at least it would be a step in the right direction according to what people indicate they want for this scenario. And I feel like this research is kind of coming out at a good time because there's changes are afoot in South Carolina with respect to notification. So DHEC and the Myrtle Beach Chamber of Commerce and a couple of other organizations recently developed a new resource called Check My Beach. It's basically a one-stop shop for all things beach. Right now, it's restricted to the Grand Strand, but it includes many different streams of important coastal and beach-related information like tides, surf report, beach cams, beach safety, and of course, water quality. And it consolidates all that into a single spot. So the idea, I think, is for this to be expanded in a next phase to cover more parts of the South Carolina coast and maybe even ultimately the entire coast. But an important thing to know is that in the Myrtle Beach area or in the Grand Strand, this tool, this Check My Beach site, was designed to basically replace the press releases that have been used there for so long, because those were causing some confusion and some uproar among the public there. So no longer are press releases used in Myrtle Beach. This is the resource that everybody is expected to use. So in the absence of the press releases and those sort of formal announcements, maybe Check My Beach and a text messaging system together combined could really fill that gap and provide some innovative ways to increase public health and safety. Another point of discussion. So we found through the questions on trust that Charleston Waterkeeper is a highly trusted and widely used source of water quality information. So the question now comes, should DHEC give Waterkeeper and potentially other organizations in the coast that like it, that do similar work, should they be given the authority to issue official swimming advisories? So Waterkeeper is about halfway there. They already have an approved quality assurance program plan, which means that DHEC has reviewed and approved their protocols for collecting and processing samples. So they're half the way there. And hypothetically, they could be given the authority to issue these more official swimming advisories. So this is an easy thing for me to write on a slide, but in reality, it might create or open up a whole new can of worms that the Waterkeeper may not be interested in opening, because for DHEC, you know, whenever they issue an advisory for a certain location, they have to go back the next day and continue to take measurements until safe thresholds are reached and they can remove the advisory. So presumably Waterkeeper would have to do the same thing to be able to lift their official advisory. And Waterkeeper is a staff of, I think, 2 or 3, maybe 4 people. They rely a lot on a volunteer network. So I'm not sure that would really be feasible for them, but it's at least a question worth asking and a conversation worth having. And I think at a bare minimum, in terms of collaboration, DHEC could provide links to the Waterkeeper and other programs that have approved quality assurance program plans in place from their own website, just so for people who are more accustomed to visiting DHEC for this kind of information can realize, okay, there's this type of monitoring going on in some of the coastal rivers and creeks as well. So just that back and forth could probably help raise the visibility of the issue and the data itself. Another discussion point. So testing new variations of the swimming advisory message may be warranted. And it's, really, I think it's going to be essential if ultimately in the future there is a text message based system that's used for the public. So what this might look like based on stakeholder feedback from the survey is something short and sweet. And, DHEC and Waterkeeper both have, I guess, the luxury right now of having entire web pages to explain the situation and to provide a lot of extra context. But if you do move to a text message system, obviously the message has to be much more concise and very specific so that people will read through it and so that it won't create any confusion or ambiguity. So just an example of what that might look like. And this is, again, integrating some of the recommendations from people provided in the survey. We might have something like Folly Beach Pier, so starting off with the location. Water contact advisory, this is an alternative term to swimming advisory. Due to high bacteria levels, gastrointestinal illness, rashes, and eye, ear, wound infections are more likely than usual. So that's just a, kind of a conceptual example of what it might look like in a text-based format. And shifting gears a little bit to future directions. These are basically things that I'd like to put on my plate and studies that I'd like to kick off after getting these results wrapped up and finished. So obviously I'd like to replicate the study at a broader scale, ideally throughout the Southeast, or at least at another location in the Southeast, just to ground truth these results and make sure that there's nothing inherently different or unique about people in Charleston, or coastal recreation people in Charleston. And given logistical constraints with respect to analyzing water samples, I'd love to include questions on future surveys about the acceptability or how acceptable stakeholders would find bacterial nowcasts or forecasts for making personal decisions. So this is a major issue. Both DHEC and the Waterkeeper currently use traditional lab culture lab culturing techniques to find out whether or not these indicator bacteria are present in the water samples that they've taken. This takes 24 to 48 hours. So, you never really have real-time conditions. You're not reporting real-time conditions, you're reporting on how things were a day or two ago. So for those people who are really interested in getting real-time information, we can't do it right now. There are certain qPCR methods that are getting us closer to that, but it simply isn't possible technologically right now to have real-time information on bacterial levels in the water. So there's several of these nowcasting and forecasting projects that are occurring in the Southeast right now, and they all seem to be kind of converging. So one is headquartered here at UofSC. It's called How's the Beach. It's active in 3 different states, and it uses historical trends combined with in situ measurements of water quality and other parameters to make predictions on what water quality levels are at any given moment. Similarly, there's something like that going on in Florida. There's also a project in North Carolina that I think is focused more on the health and safety of shellfish, but uses a lot of the same methods. So again, these 3 forecasting and nowcasting type efforts seem to be kind of converging into one great thing here. And so I think there's definitely some room to maybe use these for these target audiences that are really interested in having real-time data. Another future direction is to conduct a similar study specifically targeting tourists and visitors. So I think personally, if we ask these same questions to tourists and visitors, we would get very different responses because there are a lot of different barriers to tourists seeking out information on water quality. Technological barriers being one. I, for one, if I were going to the beach for a week, I probably wouldn't be very likely to download an app or to sign up for a tech subscription service if I'm only going to be there for a week. I think in my mind, I would think of it as cluttering up my phone or something like that. From the psychological side, When people are on vacation, frankly, they might not want to hear bad news about bacteria in the water because, they're there to have fun and they just don't want to hear it. And similarly, on the economic side, people have paid a lot of money to go to these coastal locations, so they might want to squeeze every bit of value they can out of what they paid, and they might not want to have to stay away from the beach for a day or two for fear that they're kind of losing money essentially. And I guess this is the final future direction. This is an idea I had just last week, and this is kind of a big picture national level type thing. But if you look at federal funding for the Beach Act from 2001 to the present, it would basically be a flat line. That's why I didn't graph it, because it would have been such a boring graph. It's basically been flat line for the last 20 years. It's never exceeded $10 million in a single year. And keep in mind, this is $10 million distributed among 38 grantees. So we have 30 coastal states, 5 coastal territories, and then several tribal governments that are all eligible to receive grants. So these, the amount of money that each state receives is really just bare bones, and it's probably not enough for them to really feel comfortable in trying some more innovative methods to do both the monitoring and the notification piece. So I'd love to publish some work on that basically compares these funding levels, which again are just a flat line, to the increasing numbers of probably coastal illness or illness resulting from coastal recreation. Absent that, just the sheer number of people who are recreating at the beach, or even just the sheer number of people moving to the beach. So coastal population, I think all of those would show sharp contrast with this really flat level of federal funding over the last 20 years. So this is a short list of the references I cited in the presentation, and I'll stop here with 8 or 10 minutes left. My dissertation committee has been incredibly helpful. They're listed here at the bottom. And I welcome any questions that you have.
All right, thank you very much, Zac. Great presentation.
Thanks.
And there we go. Okay, folks, now we have the opportunity to pepper Zac with a few questions. Anyone want to start? Dr. Scott.
Okay, Zac, great job. Wonderful presentation.
Thank you.
I was real curious, in the estuarine waters, do they also use Enterococcus there, or is it E. coli there? I was just kind of curious as far as the indicator goes.
As far as I know, the preferred indicator in all coastal and marine waters right now is Enterococcus, simply because it's so resilient to salt water. It's almost ubiquitous. It's in the gut of all humans and pretty much almost all marine, warm-blooded marine or warm-blooded mammals. So it's over the years, it really has become the preferred indicator. I will say that the most recent guidance from EPA is suggesting that because so much coastal illness seems to be resulting from viruses, they're suggesting that coliphages be included as an important indicator. So that's kind of a recent development. But for right now, Enterococcus seems to be the go-to.
Yeah, and the study we did with Jack Colford, the only indicator that tracked with illness were the coliphages, Southern California beaches.
Huh.
So that's really, good that they're moving that direction.
Yep.
The reason I'm asking that question, we had a situation after Katrina where we were measuring the beach water quality after Katrina and the shellfish areas. And so using 2 different indicators. And so what we found was that the beaches should be closed, but we found that surprisingly, the E. coli counts were low in the shellfish areas. And you would have really thought that if anything would have been high, it would have been the concentration by the shellfish. It really posed a real dilemma of how to present this information to the public, that it was okay to go swimming, but it was not okay to go swimming, but was okay to eat shellfish. That really was not logical. So now in freshwater, don't they still use E. coli in freshwater for contact recreation? I'm just curious. Or
That's a good question. I'm not sure if they're sticking with E. coli in freshwater or not. I'll have to look that up.
maybe someone from DHEC might can comment on that.
Yeah.
Anyway, wonderful talk. And I really love the fact you got the businesses involved. That was really good to do.
Yeah, that was a really valuable contribution from one of those subject matter experts that I spoke with early on. They very, very strongly said, you know, I think you need to get the business owner perspective on this because they're in a really unique situation.
So Mary Beth asked the question about whether or not the water keepers share their data. And I can speak to several organizations here in South Carolina, including the Charleston Waterkeeper and the Midlands Rivers Coalition. And the answer is absolutely yes. Charleston Waterkeeper has been great to work with for us. And they're actually looking at the model that has been put into place with the Midlands Rivers as a means to increase the collaboration and be able to better address the issue that Zac raised about you go out and sample one day and you end up with an elevated level, then responsibility is to go out the next day. And the coalition that we put in place here in the Midlands, courtesy of DHEC and Myra, does that. But the water keepers have all been very generous in the sharing of their data because they want to make sure that we're not putting people in peril.
Yeah, and I can add to that the Charleston Waterkeeper is incredibly sharing of their data. Not only do they make, you know, the most recent test results very easily accessible, but on their website they also have previous testing results dating back, I think, up to 10 years, maybe even since the organization was founded. But it seems like they're very encouraging of people taking historical data and kind of conducting their own studies with it. And then in addition to that, their data is also served up through this national app called Swim Guide, which is really cool. It's, you know, it's a nice, sleek, highly produced app where you, once you turn it on, it tracks it figures out where you are, and then it tells you the status of beaches all around you. So you can use it nationally. And I think Charleston Waterkeeper is the one that provides that app with obviously their own data, but I think they also share the DHEC data so that both DHEC and Waterkeeper data are available on that app.
Then Mary Beth had a follow-up question about the pushing of information out. And I can speak to our efforts here, courtesy of Zac's research and the engagement we've had with users related to the Midlands Rivers Coalition. There are, I was hoping Dan would be on here because I'm going to botch this response, but there are a number of processes that we've been implementing in pushing information out to targeted audiences, which is supported by Zac's findings.
Yeah, and I think for my survey respondents, you know, the term graphic didn't really appear in a lot of their responses, and it certainly wasn't a term that appeared in any of the questions, but a lot of the responses lead me to think that they want a graphic component to them. One thing that everybody, or not everybody, but many of them suggested is an indication of the level of risk. And one way that many of them suggested that be communicated is through color coding, which is currently done, you know, by both DHEC and Waterkeeper. But I think the more visually appealing you can make it, the easier time they'll have understanding what the level of risk is. So I think at a bare minimum, color coding should be an important part of it. But there's so many great infographics out there. I mean, there's myriad different ways that you could share this information. I think focus groups would be really fun to do, testing out some different ways to relay the swimming advisories.
Well, considering we're hoping to keep Zac on board after he finishes up his dissertation, there's a number of opportunities. Lindsay, do you have your hand up?
I do. Can you hear me? Because I switched computers.
Yeah, loud and clear.
Okay, good. So I was just gonna ask, because you had made a mention how you kind of wanted to do the survey to like another type of community besides Charleston. Have you looked at, I guess, looked at where you would try to do these types of surveys elsewhere, but like, is it going to be more of like a potential like residential kind of community, kind of similar to like, like in Charleston, a lot of people live along the beach. There's not as many like hotels or anything versus like a different area like Myrtle Beach or a different state completely. Cause I'm just kind of curious if you would get completely different responses in those two different types of communities.
Yeah, that's a good question. I think, doing it in Myrtle Beach honestly might be an interesting way to hit that tourist community that I really don't have any representation from with the current project. I do, like I said a bit ago, I think the results would be quite different if you compared resident populations to tourist populations. But even with the with the Charleston group, which was 95% residents, there's just something inside me that makes me want to do the study again in another similar place with a similar resident population base, just to make sure that, this wasn't an outlier. I mean, I have a feeling it's not, because this is just the way that technology is moving in general. People want things delivered to them instantly the moment that it's available. So the results weren't terribly surprising, but it'd be great if somebody else would do it in another coastal city in North Carolina or something like that. But
would the Beaufort Bluffton area be mostly residential?
Well, Kim ever gets her.
That was uncalled for.
Yeah,
There are a lot of residential, obviously, in the Bluffton Hilton Head area, but clearly there are over several million visitors on Hilton Head, and a different type of access. That's beach access compared to Bluffton, which is river access. So different uses recreationally as well.
And as a follow-up into Lindsay's question, I'll also point out that Katya is working up in the Surfside area, so within the Grand Strand, and doing something distinctly different, but in some ways compatible to what Zac has been doing in the Charleston area. Okay,
Yeah.
so, sorry.
Oh no, I was just gonna say, yeah, and I was just like kind of thinking like if you were to even like kind of like survey someone like, like maybe people that like worked at hotels or like hotel owners or property owners that rent out. I'm kind of curious if they're along the lines of people that don't want to know because they don't want to warn visitors or anything else if they're worried that would impact anything. So that was just like a slight curiosity. And also before earlier when you guys were talking about fresh water, I believe E. coli is still the standard for fresh water, not enterococcus, just so you know.
thanks for that, Lindsay.
No problem.
Dr. Scott, you get the last question, sir.
Okay, yeah, Zac, one question I had was the two comments. One thing we don't have good numbers on is how many people actually swim in estuarine waters versus our beaches. We probably have estimates on how many tourists at least visit our beaches. I think it would be one thing we really need information on is what is that demand on estuarine waters? And obviously with harder and harder beach access, not enough parking places, more people are going to estuaries and boats. I think we're one of the highest states in the country per capita for boat ownership. So the last question I have, do they post the warnings from the waterkeeper anywhere like at boat landings or anywhere like that where people are going out so that they're aware? Because it seems like that would be a good point of contact to get that information out. We certainly post a lot of other information at boat landings, and I was just wondering if anybody had thought about doing that.
Yeah, I don't believe that the waterkeeper uses any signage. I could be wrong about that. There may be one or two spots that are just consistently hot spots according to their monitoring, but I think they're primarily relying on digital outreach and communications to get the word out for their stuff.
Okay.
Does that answer the question, or was there a
No,
was a
that's
second
fine.
one?
I just was wondering if anybody, I saw that sign for Ocean Lakes Campground. So that's always been a bad area. So
Yeah.
Anyway, I was just curious whether any signage at boat landings had been contemplated. Obviously the digital, is good. And the other comment on the tourists, how do you get them involved? I bet you when they sign into the hotel, they have to give their cell phone. And if they were to give a visitor an option that they would want to receive those warnings when they're filling out their information for the hotel room, they could indicate whether or not they would or would not want it. That way you wouldn't be contacting somebody that didn't want to hear that. So
Right.
just a thought that would be something you could add to the hotel registration that would get that phone message out if people did want to hear it. You may have some people with kids that have underlying illness or family members, those kind of things.
Yeah, that'd be an excellent way to build it into the registration process like that at the hotel would be a really easy way. And that way, once they check out of the hotel, they could discontinue the text
Yeah,
messages
exactly.
and then they're not getting stuff that they don't care about for the next.
Yeah, you could put it for a time period and that's all
Right.
you get it or something. Yeah.
Yeah.
Okay, folks, I hate to bring this to a close, but we've got another commitment coming in here. So once again, thank you, Zac. Great presentation.
Thanks, everybody.
Great participation. Wow, that was a struggle. Great participation again, folks. So greatly appreciated. Katya, can you remind me who our presenter is next thing?
Absolutely. So we have Dr. Chatterjee's lab students next in the following week. So we have Poonam Saha to present.
Great.
And the flyer will be distributed on Monday.
Okay, well, again, thank you all. With that, we're going to bring it to a close because I have a 1 o'clock meeting I was supposed to get to. So thank